Welcome to the Donor Research Network Symposium series. My name is Thijsen, and I work as a Senior Research Assistant in the Donor Research Team at Australian Red Cross Lifeblood. In this presentation, I will share with you a project that focused on supporting blood donors who experience a vasovagal reaction and to help them to return to donate blood again. Before I continue this presentation, I would like to acknowledge the Dharawal people, traditional custodians of the land on which I work, and pay my respects to their elders past, present, and future, and the continuation of cultural, spiritual, and educational practices of Aboriginal and Torres Strait Islander people. The problem that this project focused on are vasovagal reactions. A vasovagal reaction is a reflex of the involuntary nervous system that causes reduced blood flow to the brain. A person can experience dizziness, feeling lightheaded, blurred vision, nausea or vomiting, and it may progress to a loss of consciousness. It is the most common acute complication related to blood donation. At Australian Red Cross Lifeblood, we recorded around 25,000 vasovagal reactions in the year 2019. It is probably unsurprising that vasovagal reactions have a large negative impact on donor return rates. When we looked at our whole blood and plasma donation data, we found that compared to other adverse event types, such as phlebotomy injuries and citrate reactions, donors who experienced a vasovagal reaction had the lowest proportion of donors returning, and those that did return took a longer time to return and made fewer donations in the next 2 years. We also found that when it comes to donor return, we saw similar effects of milder reactions in which the donor experienced dizziness and more severe reactions where a donor experienced a loss of consciousness. We didn't see any significant effects between these donors in return rate for whole blood donors and time taken to return and subsequent donation frequency for both whole blood and plasma donors. This shows that even mild vasovagal symptoms have detrimental effects on donor return. But we still saw that some donors opted to return to donate again after experiencing a vasovagal reaction. We therefore decided to explore blood donors' views and experiences of a vasovagal reaction, and we wanted to find out why some donors wanted to continue donating blood and why others decided to stop. By understanding why some chose to return while others didn't, we hope to develop an intervention to better support donors after a vasovagal reaction and to help them to return to donate again with confidence. We were interested in learning more about the donor interpretations of the event, and therefore we chose to conduct a qualitative study as not much was known about this topic. We interviewed 35 participants who had recently experienced a vasovagal reaction during a whole blood or plasma donation. We had decided to use telephone interviews so we wouldn't be restricted in terms of geography, and we could reschedule the interviews at a time that best worked for the donor. We used a semi-structured interview guide to allow for open responses while also making sure we covered the topics we wanted to explore. We talked about how the donor experienced the vasovagal reaction, why they thought it had happened, how they thought the staff had managed the reaction, and how they felt about coming back to donate again and what would encourage them to donate again. In our analysis, we developed a conceptual model to explain how the occurrence of a vasovagal reaction affects donor return. I'll now share with you some of the factors that we identified in our analysis. One of the factors that we identified as affecting donor return was being aware of the potential of having a vasovagal reaction. Donors described feeling calm during the event because they knew of the possibility of experiencing a vasovagal reaction. This awareness came from information given to them by Lifeblood, having already experienced a vasovagal reaction either during blood donation or in another setting, or because they work in a health-related setting. Feeling calm during the event helped them to have a more positive donation experience and made them more likely to return to donate again. For example, this first quote from a donor who was made aware of vasovagal reactions by information given to him by Lifeblood. I was fine because they tell you this could happen. It honestly did not worry because I thought, well, this happens sometimes. On the other hand, the second quote shows a donor who felt quite frightened because she did not know what was happening. She told us, "I remember feeling quite frightened, not at the care that I was given. I felt very safe, but just that I didn't know what was happening to me." These stories show the importance of letting donors know about vasovagal reactions. Another factor that we identified was having a perceived controllable cause. Donors who felt that they could identify why the reaction had happened and felt that they could change their own behavior to avoid another reaction had greater intentions to return. For example, this first quote is of a donor who came back because he thought he had the reaction because he didn't have enough liquid or food. He felt that he could change this perceived cause by changing the outcome of his next donation. On the other hand, the second quote is of a donor who felt his anxiety caused the reaction. He did not know how to change this cause, and we did not see this donor return to donate again. This finding shows that we could help identify potential reasons for why they had the reaction and give donors strategies to help them reduce their perceived risk of having another event. This ties in with the perceived risk of having another reaction. Donors who felt that they had a low risk of having another reaction were more likely to return compared to donors who felt that they would have another reaction if they were to come back to donate again. For example, this first quote is from a participant who felt their risk was quite low because they would have a proper breakfast before coming in to donate again, which was something he didn't do at his last donation. On the other hand, the second quote is from a participant who did not know why the reaction had happened, and he felt his risk of having another one was high. He said, "I feel like it's something that's going to happen again because I didn't expect it to happen this time." We did not see this donor come back to donate again. These quotes show that it is important to lower the perceived risk of having another vasovagal reaction in order to improve donor return. This ties into the next factor, which was having clearly defined coping strategies. Donors who had identified strategies they could use at their next donation to minimize their risk of having a vasovagal reaction showed greater intentions of coming back. We heard donors mentioning problem-focused strategies, such as using applied muscle tension or wad loading, learning more about the plasma donation procedure, or by changing their donation type from plasma to whole blood. Others identified a few emotion-focused strategies, such as having social support or distracting themselves during their donation. For example, the first quote is from a donor who felt that having the knowledge of the donation procedure will help her during their next donation. She said, "I think for me personally, it's about understanding the process that helps to alleviate a lot of the concerns. I would be surprised if I had another negative experience." So by having this knowledge, she felt her risk of another reaction was low, and she actually returned to donate again. The second quote is from a donor who isn't sure yet how she will prepare herself for her next donation. She asked us for some more information about what kind of emotion-focused strategies there are available. She said, "If I was sent some information on how to better prepare emotionally for a donation, just some kind of calming techniques or something reassuring, tips on how to stay calm." This shows an opportunity for blood collection agencies to share information about coping strategies, and that can help increase donor retention. Finally, we also found that social support was a strong influencer of how the donor appraised the event and also influenced donor return behavior. Donors felt more likely to come back if they could bring a support person with them or if they felt supported by staff at the collection center. So taking these learnings from the donor interviews, we developed new materials to provide better support for donors after experiencing a vasovagal reaction. It is important to note that at lifeblood, donors who have a mild reaction, meaning those who did not have a loss of consciousness, do not receive any follow-up communication from the organization after they have left the center. We saw this as an opportunity to introduce new materials and to help better support these donors. So we developed three new types of materials. The first was a short message to be sent as a SMS as soon as possible after the event. The SMS was designed to thank the donor for coming in and to provide them with lifelike contact information in case they feel unwell or if they have any further questions. It was designed to really increase feelings of support from Lifeline. The second was a longer message to be sent as an email within the week of the event. The email also thanked the donor for coming in to donate, provided reassurance that these reactions are not uncommon, but that the likelihood of it happening again is not high. It also included information on potential causes of vasovagal reactions and strategies that they can use to reduce their risk of having another event. Both the SMS and email included a link to a newly designed webpage, which provided donors with more in-depth information on potential causes of vasovagal reactions and coping strategies to reduce their risk of another event. We tested these materials in a 4-arm randomized controlled trial. Donors were either sent the SMS, the email, both the SMS and email, or they did not receive any of the materials, which was our control group. The participants of our trial included whole blood and plasma donors who had experienced a mild vasovagal reaction during their last donation, and they were eligible to return to donate again, meaning they did not have a deferral in place. Our final sample included just over 4,700 whole blood donors and 4,800 plasma donors. In this trial, we found that the email significantly improved return rates of first-time whole blood donors. Donors in our email-only group were 34% more likely to return within 6 months compared to the control group. However, we did not find an effect of the SMS or the combination of the SMS and email in any of the groups. We didn't see any significant effects of the materials on plasma donor return or on the return rates of more experienced whole blood donors. So to conclude, we found that the decision to return following a vasovagal reaction is affected by multiple factors, including being aware of the risk of vasovagal reactions, believing the reaction was caused by something that the donor can control, having a low perceived risk of having another reaction, having clearly identified coping strategies for their next donation, and feeling supported by their own social environment or by blood collection staff. We found that by addressing these factors in an email sent soon after the vasovagal reaction, significantly increased donor return among first-time whole blood donors. Thank you for listening to this presentation. If you have any questions about this work, please feel free to contact me via email. I would also like to thank the Donor Research Network for organizing this symposium series. Thank you.